Urinary tract infections, or UTIs, are a very common health issue worldwide. They can affect people of all ages, genders, but some groups are more prone to developing UTIs than others. In the general population, the prevalence of UTI really depends on your geographic location, the socioeconomic status, and if you have access to healthcare. Now, UTIs account for millions of healthcare visits each year around the world. When it comes to gender distribution, females get UTIs more often than males, and that's really due to the anatomical differences between males and females. By that I mean females have a shorter urethra, which allows the bacteria to travel up the urethra into the urinary tract a lot easier than it is in males. Also, hormonal changes during pregnancy and menopause can make females more susceptible to UTIs as well. Now, just because males are less likely to get UTIs, they still can get UTIs. In males, the UTIs are associated with the urinary tract abnormality like an enlarged prostate or a urinary catheter use. And in some cases, sexually transmitted diseases can also cause UTIs in both men and women. So today we're going to talk about this common health problem that a lot of people experience. So if you've had a UTI before or you just want to learn, you're in the right place. I'm going to talk about the symptoms, the causes, and the treatment for UTIs. So let's get started. Hello everyone and welcome. My name is Dr. Jaspreet Singh. So let's get started with our today's topic on urinary tract infections. The urinary tract is responsible for producing and eliminating urine from our body. The urinary tract consists of kidneys, the ureters. The ureters is the tube that connects the kidneys to the bladder, and the urethra. Now, UTIs commonly happen when a bacteria enters the urinary tract, most commonly E. coli, and causes an infection. So let's talk about the signs and symptoms associated with UTI. Most commonly, you'll see a strong urge to continue to urinate over and over, burning sensation when you are urinating, lower abdominal pain, a foul-smelling urine, and in severe cases, you can also have fever and chills. It's also very important to note that UTI symptoms can vary depending on where the UTI is. By that I mean, if the UTI is in the bladder, it's called cystitis and it will lead to the urinary symptoms like burning with urination, urge to urinate, lower abdominal pain. But if the UTI has progressed upwards in the urinary tract and has infected the kidneys, it's called pyelonephritis, and you can have more severe symptoms such as nausea, fever, chills. If pyelonephritis stays untreated, it can actually get pretty severe and even lead to some infection in the blood as well in serious cases. If you guys are liking the content of this video and want to see more videos just like this, consider liking the video and subscribing to the channel. It helps the channel grow. Now let's talk about the causes. Like I said before, the most common culprit for UTI is a bacteria called E. coli. Now, E. coli is commonly found in our intestines. There's a few ways this bacteria can enter the urinary tract and cause infections. So let's go over the causes. In women, the close proximity of the urethra to the anus makes it easier for the bacteria to get to the urinary tract. Sexual activity can also introduce the bacteria into the urethra, leading to the UTI. Other factors that can lead to the UTI is poor hygiene practices, use of a urinary catheter, menopause, which can thin the lining of the urethra, making it more vulnerable to UTIs, weakened immune systems, and other medical conditions like diabetes or kidney stones. So what should you do if you suspect you have a UTI? Well, the best thing to do is go see your primary care doctor. They will do a urine sample looking for bacteria or white blood cells that may be indicative of this UTI. Now finally, let's talk about the treatment options for UTI. Now, you probably guessed it, the treatment for UTI is antibiotics. Now, the antibiotics will depend on how severe your infection is, what is the most likely cause, which bacteria of the infection, if you're allergic to any antibiotics. So your primary care doctor will tailor your treatment depending on these factors. Now, if you do have a UTI and are prescribed antibiotics, I urge you to complete the whole course of antibiotics to make sure the infection is completely eradicated. Now, in addition to antibiotics, there are a few things that you can do to prevent the UTIs. The first thing is drinking plenty of water. The water will help flush out your urinary tract from any bacteria that may be entering in there. Now, secondarily, urinating before and after sexual intercourse can also reduce your risk of infection as well. And practicing good hygiene while going to the bathroom is very important in preventing bacteria from entering your urethra. Now, if you have recurrent UTIs, meaning you get UTIs pretty frequently over and over again, your doctor may recommend doing imaging tests or may even send you to a specialist like a urologist for further testing and imaging. It is very important to prevent these recurrent UTIs to prevent any future complications and keep your urinary tract in optimal health. So there you have it. We covered the signs and the symptoms of UTI. We covered the causes and what the treatment options are for the UTI. I hope this information was helpful. If you guys want to recommend any future topics for any video, please leave a comment below. And thank you so much for watching. Stay healthy.